Imagine this. A silent yet deadly threat lurking in the waters of Florida, capable of causing severe infections and even death. This isn't the plot of a horror movie. It's the reality of Vibrio vulnificus, often referred to as flesh-eating bacteria. Florida has now confirmed 13 cases of this alarming infection across 11 counties, with the tragic death toll climbing to 8, according to the Florida Department of Health. And here's where it gets concerning. Health officials are emphasizing that these cases are not linked to any outbreak, making them harder to predict or control. So far, 8 of the reported cases were tied to wound exposure, meaning people came into contact with water containing the bacteria through open cuts or injuries. By July 24th, 4 deaths had already been reported in Bay, Broward, Hillsborough, and Walton counties, though details about the other fatalities have not yet been disclosed. But there's more to this story. 2024 saw an unusually high number of infections, with 82 cases and 19 deaths. A grim reminder of how serious this issue can become. Interestingly, certain counties like Citrus, Hernando, Hillsborough, Lee, Pasco, Pinellas, and Sarasota experienced a spike in cases following Hurricane Helene. Extreme weather events such as hurricanes, flooding, and storm surges can push coastal waters further inland, exposing more people to the bacteria. This phenomenon isn't new. In fact, something similar happened after Hurricane Ian struck Florida in 2022. The Centers for Disease Control and Prevention, CDC, warns that older individuals and those with weakened immune systems are especially vulnerable during such situations. Vibrio vulnificus isn't exclusive to Florida. It affects people across the U.S., particularly in Gulf Coast states. On average, between 150 and 200 cases are reported annually nationwide, according to the CDC. However, what makes this bacteria so dangerous is its ability to cause life-threatening complications. For instance, most infected individuals experience symptoms like diarrhea, stomach cramps, nausea, vomiting, fever, and chills. But V. vulnificus takes things a step further. It can lead to severe bloodstream infections or necrotizing fasciitis, a condition where tissue around muscles deteriorates rapidly. Shockingly, about 20% of those who contract this strain die. Sometimes within just 1 or 2 days of falling ill. Louisiana provides another alarming example. In 2025 alone, the state has seen 17 infections, which is significantly higher than its annual average of 7 cases. These numbers highlight how unpredictable and potentially widespread this problem could become if left unchecked. But how does someone end up contracting Vibrio vulnificus? The bacteria thrive in warm coastal waters, including both saltwater and brackish environments where freshwater mixes with saltwater. Eating raw or undercooked seafood, especially oysters, is one of the primary ways people get infected. Another common route is when an open wound comes into contact with contaminated water. Even minor scrapes or cuts can serve as entry points for the bacteria, leading to devastating consequences. To protect yourself and your loved ones, experts recommend taking proactive measures. First and foremost, always cook seafood thoroughly before consuming it. Keeping raw seafood separate from other foods is crucial to prevent cross-contamination. Additionally, washing your hands thoroughly with soap and water after handling raw seafood is essential. If you have an open wound, cover it with a waterproof bandage whenever you're near seawater, brackish water, floodwater, or standing water. After exposure, clean any wounds immediately using clean water and soap. Finally, don't hesitate to seek medical attention if you notice warning signs like redness, swelling, pus drainage, fever, worsening pain, shortness of breath, rapid heartbeat, confusion, or disorientation. And this is the part most people miss. While preventive steps can reduce risks, some argue that climate change and rising sea temperatures may exacerbate the spread of Vibrio vulnificus. Could we be facing a future where these infections become even more frequent? What role should governments play in addressing this growing public health concern? We'd love to hear your thoughts. Do you think enough is being done to combat this threat? Share your opinions in the comments below.